Hey guys, it's Catherine. Today we're going to be talking about acid-base balance. What is an acid-base balance? Well, an acid-base balance is the balance between acids and bases in our body. The body's pH level, which measures acidity and alkalinity, must maintain homeostasis for normal bodily function to happen. The body uses the heart, lungs, kidneys, and liver to regulate the levels of acids and bases to keep the pH balance within normal limits. What's considered normal? The body's normal blood pH is between 7.35 to 7.45. When the body's blood pH deviates from this range, the body starts to compensate to bring the blood pH back to normal. Also, another thing that will help us on the ambulance is actually placing our patients on end-tidal CO2, and our normal range for that is 35 to 45 millimeters mercury. Also, we have this little scale right here, which we don't really use. We'll have to have labs to actually get a blood pH in the hospital. But 0 is more acidic, all the way to 14 is the most alkaline, and right there in the middle is the white. So 7.35 to 7.45 is where our blood needs to be. And if it goes acidic or alkaline is when our body starts to freak out and have problems. And we'll talk about that in our next slides. So what happens if the pH is below 7.35? When the body's blood pH drops below 7.35, the body becomes acidic. Again, when the blood pH deviates anywhere from the normal, the body starts to compensate to try and regain homeostasis. So anything that is below 7.35 is acidosis. But is it respiratory or metabolic? So how to know if it's respiratory or metabolic? Respiratory acid-base imbalances refer to issues with the lungs and the carbon dioxide expelled and retained. Metabolic acid-base imbalances are not related to the lungs, but refer to an excess of acid or a decrease in bicarbonate in the body. But respiratory and metabolic come with their own signs and symptoms, and both cause different problems within the body. A good way to figure out whether you are dealing with metabolic or respiratory imbalances is to use the Rome mnemonic. And right here to the left, you're going to see this little diagram. It says acid-base mnemonic Rome, respiratory opposite, metabolic equal. So respiratory acidosis. The pH is going to lower and the PCO2 is going to increase. Opposite, the pH is going to increase, and then you're going to have a decrease in the PCO2 and alkalosis. And then your metabolic acidosis, the pH is going to lower, and it's going to be lowered on the PCO2 as well. And then metabolic alkalosis, the pH is going to increase, and the PCO2 is also going to increase. Respiratory acidosis. Respiratory acidosis occurs when there is too much carbon dioxide in the blood. pH that is less than 7.35 would be considered acidotic. What causes respiratory acidosis? Well, respiratory acidosis is caused by a decrease in the respiratory rate or efficiency, which leads to a buildup of carbon dioxide in the blood. This can be caused by different lung diseases such as COPD, asthma, pneumonia, acute respiratory disease, respiratory failure. The patient could have a pulmonary embolism, atelectasis, which is where the alveoli collapse, hypoventilation, and chest trauma. Respiratory acidosis signs and symptoms. Respiratory acidosis will show, though the patients are going to have shortness of breath, hypoventilation, hypoxia, rapid or shallow breathing. More severe cases, they're going to have a lower blood pressure. They'll be altered mental status. They're going to be tired, fatigued, be lethargic. They may complain of chest pain or chest discomfort, and their skin color is going to look terrible. They'll be cyanotic or paler or even gray. And they could also have cardiac dysrhythmias. How does the body compensate in respiratory acidosis? In respiratory acidosis, the body tries to compensate by increasing the elimination of carbon dioxide through the kidneys and retaining the bicarbonate ions in the blood. This assists in the restoration of acid-base balance by reducing the levels of CO2 and increasing the levels of bicarb, which is the base. The lungs also help by adjusting the respiratory rate and the depth to eliminate excess CO2. This helps bring the blood pH back to normal, which the normal we already talked about is 7.35 to 7.45. The treatment for respiratory acidosis. So you're going to place your patient on a cardiac monitor, and depending on what's going on with them, you could give them supplemental oxygen. And when you do that, go ahead and put an end-tidal nasal cannula on them. Whenever you listen to their lung sounds, you can determine whether or not they need the bronchodilators. Also, some of these patients may need assisted ventilations, and you can do that with a bag valve mask. But overall, to actually treat the respiratory acidosis, you're going to have to find the primary cause of what is causing them to have the acidosis. There's always an underlying issue. And then just treat your patient, monitor en route, and then you're going to transport the patient to the hospital in the position of comfort. Respiratory alkalosis is a condition that refers to a higher than normal pH level of the blood due to excessive elimination of CO2 due to the increased rate of breathing. The pH is going to be greater than 7.45. Their end-tidal will be greater than 45 millimeters mercury. A lot of these patients, you'll see, at least I know most of them that I run on, they're having anxiety attacks. But the common causes of respiratory alkalosis are hyperventilation from anxiety, panic attacks. The patient could have fever. They could be experiencing pain. They could be asthmatics. They could have pneumonia. Even certain type of medications, such as like aspirin overdoses, stimulants such as caffeine or amphetamines could cause respiratory alkalosis. The signs and symptoms of respiratory alkalosis would be a blood pH greater than 7.5. Their end-tidal is going to be greater than 45 millimeters mercury. They'll be lightheaded. These patients could feel tingling in their hands or face. Carpal pedal spasms, and that's just where their hands are cramping up or their feet are extended, and it hurts them a lot just from hyperventilation. The treatment for respiratory alkalosis is, first off, you really need to try to find the underlying cause of this. There's always an underlying cause. Coach your patient on breathing. Just tell them to take slower and deeper breaths. Breathe with them. Try to calm your patient and be empathetic and show that emotional support. A lot of the times that's all it takes to just kind of get them to calm down. If the cause is medical, treat the patient with medications that will help with the condition. If needed, apply oxygen and go ahead and put them on an end-tidal CO2. That way you can get your read. and just see where the patient is on that scale. Because again, we can't know the pH of their blood until we get them to the hospital, and by that time we're already gone. Go ahead and put your patient on a cardiac monitor, because a lot of the times in severe cases they can actually start showing cardiac dysrhythmias. And go ahead and monitor your patient en route, transport to the nearest hospital. But how does the body compensate for respiratory alkalosis? So our bodies are pretty great. When the body is in respiratory alkalosis, it tries to compensate in several ways. First, the body decreases elimination of CO2 through the kidneys and less bicarbonate ions in the urine. By doing this, the acid-base balance will begin to restore by the increase of CO2 and the lowering amount of bicarbonate in the body. The lungs also play a part in compensation, because they also adjust to the rate and depth of breathing to retain as much of the CO2 to get back to that normal range, homeostasis. The body's always going to try to put us back where we need to be. This helps the blood pH reach normal levels, which again are 7.35 to 7.45. You will want the patient's end-tidal CO2 to be in the range of 35 to 45 millimeters mercury. Metabolic acidosis is the imbalance in the body that causes a lower than normal pH level in the blood, pH lower than 7.35, and the end-tidal CO2 will be less than 35 millimeters mercury. The causes of metabolic acidosis, there's several things. They could be factors that could be involved, like kidney disease, uncontrolled diabetes, DKA, lactic acidosis, or certain medications. Your DKA patients, a lot of them are non-compliant or just not taking care of themselves like they should. Lactic acidosis is, you can see those with patients that are dying or have went into arrest. Their cells in their body are just not getting enough oxygen. And then your certain medications. Signs and symptoms of metabolic acidosis is rapid breathing. They're going to be altered. They're going to present tired, with fatigue, lethargic. These patients can also complain of nausea. The treatment for metabolic acidosis is, first off, again, you need to figure out the underlying cause of this problem. It could be certain medications that they've taken. You need to try to do interventions to restore the acid-base balance, such as giving them fluids or administering sodium bicarb. Oxygen therapy with end-tidal CO2. Put them on the cardiac monitor. Make sure that they don't have any cardiac dysrhythmias going on. And then just monitor these patients, put them in the position of comfort, transfer them to the hospital so that they can get further evaluated. How does the body compensate in metabolic acidosis? When the body is in metabolic acidosis, the body tries to compensate by increasing the rate and depth of breathing. This helps eliminate excess amounts of CO2 in the body and decreases the acidity of the blood. Also, the kidneys try to help. They excrete more acid, but then they retain more of that bicarbonate to achieve the acid-base balance. So they're excreting the acid, but keeping the base. They're trying to regain that homeostasis. Metabolic alkalosis is a condition where there is an excess buildup of bicarb in the body, leading to an increase in the pH level of the blood. Causes of metabolic acidosis are the patient could be experiencing excessive vomiting, or just bouts of vomiting throughout the day. They can also be taking a crazy amount of alkaline substances such as antacids, water pills, laxatives. Um, both of those things can make the body dehydrated, and then that's going to throw in them being uh, there being an imbalance in electrolytes in the body. Also, if the patient has experienced a drug overdose and then they had to have their stomach pumped, that could also cause metabolic acidosis. It can also be caused by conditions from the heart and liver and kidneys. So if you have anything going on there, pretty much you can have this. The signs and symptoms of metabolic acidosis are pH greater than 7.5, end tidal greater than 45 millimeters mercury. They're going to have nausea, vomiting. They could have diarrhea, muscle twitching. They're going to be weak and tired. They could have altered mentation and possibly have cardiac dysrhythmias. The treatment for metabolic acidosis or alkalosis is finding the primary cause for the alkalosis, correcting with fluid and electrolyte imbalances, administering medications that could restore the homeostasis of the acid-base balance, getting them to stop any medication that could also be contributing to the alkalosis, place the patient on end-tidal CO2, put them on cardiac monitoring, monitor en route, and just transport them to the hospital. How does the body compensate in metabolic alkalosis? When the body is experiencing metabolic alkalosis, the body tries to compensate in several ways. The body will decrease the rate and depth of breathing. By doing this, the body retains CO2 and in turn increases the acidity of the body and restores the acid-base balance. The kidneys start to eliminate more of the bicarbonate ions and less of the acid or hydrogen ions. This brings the acid-base balance back to normal. Acid-base balance is overall very vital in keeping our bodies functioning correctly, and it is just amazing the length that it will go to bring it back to a homeostasis. Hopefully this presentation has helped whomever watches it. Hopefully it helps them understand it more. Thank you.